Amid the ongoing medical dispute, the government has announced measures that will ultimately allow hospitals to accept the resignation letters submitted by trainee doctors. As yet, no significant movement has been seen by the residents. Choi Soo-hyung has the latest.
The Ministry of Health announced on Tuesday that it will leave the order prohibiting the acceptance of resignation letters submitted by residents to their hospital directors. All orders being given to residents will be halted the same day.
Starting Tuesday, the government is withdrawing orders for hospital directors to accept resignations and for residents to return to work and maintain patient treatments. This will allow residents to decide individually whether to return to their hospitals.
It added that in over 3 months of operation by its emergency response system, changes were inevitable to entice the return of the residents and to reduce the fatigue of medical staff caring for the trainee doctors. Currently, over 13,000 residents have left their hospital positions to protest the government's medical reforms, including the expansion of the medical school quota. They now have the option to look for work elsewhere if they don't want to return to their regional hospital. The government stated that it was time to allow the residents to resign as they wished, enabling them to continue their training at any hospital since the medical school quota expansion has been finalized. Only about 8% of the residents have gone back to the hospital so far, but the ministry added that it hopes many more will return. However, the majority of the trainee doctors are holding firm in their stance not to return to work. Immediately after the announcement, Park Dan, the head of the Korean Intern Residents Association, posted on Facebook that nothing had changed. Also, hospitals have doubts about whether residents in essential medical services such as surgery, obstetrics and gynecology will return. Many residents don't want to due to the burden of medical lawsuits and the relatively harsh training conditions they have to endure. Meanwhile, the Korean Medical Association, which had warned of a bigger fight, is holding a vote until Friday on a nationwide strike, including private protest doctors. Medical professors at Seoul National University have also announced that they will conduct a vote on a further strike. The ministry stated that if the residents return, working conditions will be different from before. Minister Cho said that returning residents will have an adjustment process for the training gap to ensure they can take the specialist exam, while additional support will be given to residents who remained at work and did not join the collective resignations. It said that the residents could focus more on their training under the new measures that include amending the medical law to remove the pressure of possible lawsuits and reducing their continuous working hours. Choi Soo-hyung, Arirang News.